Hey everybody, this is Dr. Blevins with Enilda Clinic at enildaclinic.com. We are going to have a learning video today about exercise and ADHD. So ADHD is a disorder that's characterized by inattention, hyperactivity, and impulsivity. There are three different types. There's the inattentive presentation, and then there's the hyperactive impulsive presentation, and then there's the combined presentation. And they're made up by breadth of symptoms for the two previous types, the inattentive type and the hyperactive impulsive type. And if you have enough of each of those two types, then you get the combined type. There is an unspecified type whenever somebody doesn't quite have enough breadth of symptoms, but the intensity of those few symptoms they do have are so intense that it warrants the diagnosis anyway. Typically, to get a diagnosis of ADHD, the child needs to start having their symptoms before 12 years of age, and they need to demonstrate the symptoms in at least two different settings, whether that's home and school, or home and church, peer groups and school, just a variety of different settings. Okay, so now that we briefly chatted about what ADHD is, let's talk about exercise. So there's been a lot of recent research to talk about what might be the benefits of exercise and how that relates to a lot of different types of medical conditions. This video is just going to focus on ADHD today, but please know that exercise is super useful for a variety of different medical conditions. And so the big thing, I'm just going to spill the beans for you here. Exercise is wonderful for kids with ADHD. It's wonderful for kids who don't have ADHD as well, but just specifically for kids with ADHD, what we see is that overall, we're going to focus on aerobic exercise. And so aerobic exercise is where you're getting your heart rate up, you're getting your blood pumping, you're getting a little bit out of breath. The way that I like to think of it is that if you're doing the exercise, you can still talk, but you can't sing. So we'd say that that's moderate intensity exercise. And the duration that we want to think about is at least 30 minutes, okay? So that's a bout of exercise that we want to do in order to kind of qualify to have done exercise every day. So 30 minutes of moderate exercise. And so what we see from this moderate intensity exercise is that the benefits for kids with ADHD is they have improved perceptual skills, intelligence, academic achievement, developmental level, and performance on verbal and mathematic tests. For children, it's been measured in research for children ages 4 to 18 years old. And so that's really awesome. One of the big things in the studies that we're starting to see is the dropout rate for exercise as an intervention for ADHD being so prominent. And so the big helpful tip here is that if you want your kid to utilize this super healthy, natural way to help them feel better and to help them regulate their symptoms, then put them on a sports team. The sports team actually requires them to utilize a lot more of their executive functions, the things that are happening in the front part of our brain, things like being flexible, planning ahead, coordinating with their teammates, using language skills, all of those things that we're trying to grow and build and regulate. And so putting them on a sports team is really helpful to actually improving some of those ADHD skills and managing those ADHD skills. Also, I think, and it didn't say this in the articles that I was reading, but I really anticipate that a lot of the dropout decreases from being on a sports team is probably due to the motivation, because you have a coach there who's giving you a lot of reinforcement. You have same age peers who are giving you a lot of reinforcement. It's a fun social activity. It's not just being on a treadmill or being forced to walk around the block or do some arduous exercise activity. And so if we think about exercise as being a part of our lives and using it to really be healthy and to live the lives that we want, then we want to really train our children to do exercise in the form of an activity that we love. And so that includes being on sports teams. And so really consider having your kid join a sports team as a way to help manage their ADHD, but also as a way to help them live out a value that they might have. All right, so that's one point. The next point that I want to talk about is acute cardio exercise versus chronic cardio exercise, which are super researchy terms to basically say, if you exercise 1 day a week, is that going to be helpful versus if you had your kid exercising that 30-minute moderate intensity amount every day of the week. And so there are benefits to both, but they're a little bit different. So let's take the acute situation. So the acute is just that 1 day situation. What happens? So what we see is some same day boost to your child's functioning. We have some executive functioning benefits. We do see response inhibition. So that's that automatic kind of responding, like whenever your kid interrupts before you finish a question. We see better attention management. Better flexibility in their thinking, so being able to solve problems in a variety of ways rather than constantly doing the same thing to solve the problem. Processing speed starts to pick up, and better vigilance. Vigilance is a really, I think, important executive function that parents probably don't know that they care about, but they do care about this. And so the way that I like to think about vigilance is it's that thing that helps kids who have ADHD do really, really well on video games, but are really bad at loading the dishwasher. And so if you think about whenever you ask your child to load the dishwasher, it takes them 10 minutes to do this, and then you say, great job, you loaded the dishwasher. Okay, now you can go play your video game. Now you can go play outside, whatever they want to go do, right? So they got one piece of reinforcement. They've got that great job at the end of 10 whole minutes. That's a really low rate of reinforcement. With a video game, oftentimes if you sit there and watch your child, I know I don't play video games, so I have to imagine this, but you guys see this every day, right? And so what you're seeing is this little ping on the video screen, and you can hear the noise, ping, 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 ping. And those are the tokens that they're earning, the points that they're racking up for every little action that they do. The rate of reinforcement is so high. And so that's your kid who is zoning in their attention, but they're getting reinforced at a really high rate so they can more easily manage their attention during a video game. So we compare those two activities. Real life, our reinforcement rate is exceptionally low compared to the reinforcement rate of a video game. And so as we give our kids more and more experiences with video games, it makes handling real life a little bit more difficult, as you guys can imagine. That's a freebie that I'm going to throw in with exercise. Just another reason to have your kid exercise some more. Okay, so some other things that a 1 day of exercise is going to help your kid with ADHD do better with is academic performance. Not with everything, but specifically with reading comprehension and with arithmetic, so just solving the math problems. And then it also helps with teachers' and parents' perceptions of the kids interrupting, as well as unintentional aggression. We all know that kids with ADHD have a tendency to kind of bump into people and move around, and managing their body tends to be difficult. Those types of behaviors seem to decrease. And so now let's talk about chronic aerobic exercise. So this is whenever you are exercising many days of the week. Remember, it's 30 minutes. You can talk during it, but you can't sing, okay? So getting good regular exercise in during the week. What we start to see is that you're still getting a lot of that attention benefit. So you're getting better auditory sustained attention. This means that your child is better able to listen to you. You're getting better selective attention and information processing. So this means that your child is better able to pull out the important information of all the information that's in the environment in order to process it better and to focus on what's important. They're better able to shift attention from one activity to another activity, and they're better able to plan. Their verbal working memory goes up, and so that means that they're going to be better able to respond to you in a conversation. And again, their processing speed is going to go up. Another benefit, and this one's new for the regular everyday exercise, is that their overall functioning improves. Their social emotional functioning improves. And so for our kids with ADHD, this is, some side research I'm just going to kind of tell you about real quick. We know that they get a lot of constructive, corrective criticism in their days, especially whenever they're young, before they've encountered a lot of intervention, before possibly they've been on medication management, things like that. And so oftentimes our kids with ADHD start to develop a self-concept that is a bit lower than our kids that don't have ADHD. And so having the benefit of improved self-esteem, decreased anxiety, improved depression, those things are really meaningful to a kid with ADHD. And so that cannot be overlooked here. It's really awesome that regular exercise has the ability to do these types of things. It also decreases body complaints, so just body aches and pains, headaches, tummy aches, things like that. It improves academic and classroom behaviors. And then the last one, and this is a new one as well, it improves social behaviors. So it improves the parents' and the teachers' perceptions of the kids' ability to engage in social behaviors, things like being socially competent, being cooperative, and then reducing those thought problems, social problems, attention problems, interrupting behaviors, and unintentional aggression again. And so the regular exercise does all the same things that a one-day bout of exercise does, except that regular exercise, the benefits are more broad because they start to affect your child's social skills and their mood and their anxiety. And the effects also last longer. They start to last longer than one day. And so, those are all of your exercise tidbits today related to ADHD. If you want to start incorporating exercise into your child's ADHD management routine, please be sure to always talk to your child's pediatrician. Make sure that they're healthy and talk to them about joining some sports teams, get the physicals done and all of that. And you can always reach out to EnildaClinic.com to learn more about my learning videos. And if you're in the Spokane, Washington area, you can always reach out to me to learn more about my services for assessment and for therapy. All right, it was great to see you guys. Bye.